Okay, welcome everyone, and I appreciate all of the everyone who's joining new, and all of those of you who might have attended our previous open house and are staying on to listen to and talk about our Great Lakes region. We are super happy to have you here today. So I will introduce myself, and then I'll go over a little bit about the consortium NPTC and our Great Lakes region specifically. And then we're going to throw to each of our training directors and site representatives to talk a little bit more about each of the individual sites that we have in the Great Lakes region. So my name is Dr. Angela King. I'm a clinical psychologist, and I am the president CEO of NPTC, and also I serve as the regional training director for our Great Lakes region. So we appreciate you being here today, and we're super excited to tell you a little more about NPTC. And first off, let us just express our gratitude for considering NPTC as your training site. We know you have lots of options and places that you're looking into, and we are glad that you're exploring our consortium and some of our wonderful sites that we have in our Great Lakes region. So just a little about us, our history. NPTC, previously we were known as Heart of America Training Consortium, and we were developed around 2002, 2003 out of a workforce development grant with the goal of providing training to interns in rural and underserved areas, and with the goal of increasing workforce development in very critical areas, rural areas that struggle to get workforce and psychologists to come and work and live in those communities. So we have been around for a while, obviously, and our Great Lakes region has continued to grow and expand over the years. And we view ourselves as we're more than just an internship. We don't view this as a 12-month training, start and done. We really look at this as a long-term commitment to you all training the field. And our goal is to provide you a really phenomenal training experience during your internship, and hopefully keep you on for postdoc and for employment later on. And so just a few things on our slides here to show you how much we really value our interns, and seeing that a number of our interns continue to stay with us for postdoc and supervision and being a didactic presenter down the road. So we love having interns. It is obviously what we do and our passion, and we love being able to see our interns grow and develop into professionals who are working in these communities and providing really necessary services to these key areas. So a little bit about our Great Lakes region. We were originally founded in 2013 and received our accreditation in June of 15. So we have currently we have our renewal for 10 years. Our next site visit is not due until 2031. So we have APA accreditation. We have trained over 400 interns in this region alone since the region was developed. And we have a number of interns, again, who have continued to work, stay, and live in the communities in which they have been providing services and training, and now continue to stay in these areas. So I'm going to give you a little overview again of some of the sites that we have here, but really each of the site representatives and training directors are going to be able to talk to you a lot more about what it looks like to be an intern at their organization, and what training looks like, the services they provide, and really why we hope you do consider our sites in our Great Lakes region. So we have 5 different sites that are spread out over Indiana, and then we have one our newest site member that joined us, and that site is in Ohio. So we have Adult and Child Health, Aspire, Indiana, Bowen Health, Centerstone, Health Source of Ohio, and Valley Oaks are going to be the sites that you're going to hear a little bit about today. And so what I will probably do is I will just go in order of my slideshow. And Dr. Sklar, lucky for you, you're first off, and you get to kick us off today. So if you don't mind to talk a little about Centerstone and why an intern would want to have an internship with you all, and then we'll just go in order of our slideshow, and I'll throw it to the next representative. Oh, you're muted, Dr. Sklar. We're already off on a bad start.
Some people think it's wise when I'm muted. Anyhow, welcome everybody, and I too appreciate your willingness to to get some information about the Great Lakes region with the National Psychology Training Organization. And I'm not paid for the advertisement, but it is a truly phenomenal organization, and they do great work in assisting the different sites and our ability to provide a great training program. Anyhow, Centerstone is a fairly large community mental health center. With multiple sites in multiple states. We are located in Columbus, Indiana, which is about an hour south of Indianapolis, a bit north of Louisville, and certainly within an easy drive of Cincinnati if you're looking for a big city. Well, Columbus is a town of probably 50,000 plus people. It is still considered rural, and we have placements in some of our smaller counties to give a really true rural feel to the organization or to the training experience. So we typically have 4 intern slots each year. One is full-time in our FQHC, and then the other 3 are a mix of part-time in the FQHC and the integrated health track, and in more of our traditional placements. So we try to meet the needs of the interns in terms of what their interests are. If they are interested in adult services, we can do that. But then I want people to have a well-rounded experience here, and we may give them some kid experience if they like it or not, and vice versa. So, I think we have a strong training program in rural community mental health with looking at everything that rural community health has to offer. We You'll have an opportunity to certainly have a number of counseling hours, and we certainly want you to gain a lot of experience with psych testing. So that's another one of our strengths. And I don't know where I am in that 5-minute period here, but I think that's sort of what we do.
Thank you, Dr. Sklar. Yes, and just to echo what you just mentioned, Centerstone, obviously, we get a lot of really good feedback across all of our sites, and Centerstone is no different. We get a lot of really positive feedback from interns every year about to your point, Dr. Sklar, the wide variety of services that the interns are able to get exposure to. And so each of our sites, again, just to mention, I think I said this earlier, but we'll go over a high level overview. And at the end, we're going to have a chance to have a open question and answer. And so if you have any questions for obviously Dr. Sklar, but as we move through any of the site training directors, I may ask that we kind of hold those until we get through all of the site intros, and then we will have open Q&A and be able to answer some questions that you all might have. And we have some previously submitted questions that we'll go through. And obviously we can turn those to specific sites or keep it more general for some sites to chat about their experiences. So thank you for that overview of Centerstone, and we will move on to our next site will be Valley Oaks. So we have Dr. Kulkarni, who is going to be talking about Valley Oaks as a training site.
Thank you. So as she said, my name is Monique Kulkarni. I am the site training director at Valley Oaks Health. We are a community mental health center and FQHC based in Lafayette, Indiana. We cover 10 counties. So it's Lafayette, Tippecanoe County and all the surrounding counties. And we have 3 intern positions every year. I think one thing that is maybe different about Valley Oaks compared to the other sites in the region is that each of our positions have a separate match number. So you match with the placement as opposed to matching with Valley Oaks and then choosing your placement after you match. And so that's something that you should keep in mind. If you're interested in multiple tracks with Valley Oaks, you can just indicate that on your application. And we are pretty flexible about adding or subtracting or changing the sites that you're interested in. We just kind of have an open dialogue about that in the interview process. And one interview can suffice for expressing your interest in all three of our positions. But we are, our interns get a broad range of experiences, much like Dr. Sklar mentioned, in providing outpatient mental health and substance use treatment. We have 2 generalist tracks where you're working with all ages and you have the opportunity to be in one of our Lafayette clinics for some time to have kind of that exposure to what is a little bit more of an urban environment, not quite say like Indianapolis or Cincinnati, but compared to all of our other clinics, and then have a rotation at one of our rural clinics. And so we have one where the primary placement is in Crawfordsville, which is a rural clinic in Montgomery County, 80% of the time, and then you'll have 1 day a week in Lafayette. Or if you want to flip it, then we have a generalist position that's based in Lafayette 80% of the time, and then 1 day a week at another one of our rural clinics. And then we do also have a child track position where 80% of your work will be with youth and families. And then you'll have a 1 day rotation at a rural clinic where you will get some exposure to working with adults, but it won't be the bulk of your experience by any means. And then the other thing that I wanted to add, our Crawfordsville position, something to keep in mind if you're really interested in substance use, working with that population. The primary supervisor at that location is also a licensed clinical addictions counselor, and we have a really robust continuum of substance use treatment at that clinic. And we also have an opportunity there, if you're interested, to be involved in a jail-based chemical addictions program that we run out of the Montgomery County Jail. And then something that I'll say that I think is kind of different about Valley Oaks maybe than some of the other sites. I think we all have lots of NPTC graduates who are supervisors in our internship program. So Valley Oaks is no different. Several of our supervisors were graduates of the NPTC program, but we also have a mix of folks in clinical and administrative roles who are supervisors in the program. And so we really strive not just to make sure that our interns are getting that clinical support, professional identity support, but also sharing kind of a behind the scenes picture of how decisions get made and operations are determined within a mental health center, so that you leave with an understanding not just of kind of how to deliver that clinical care, but why certain decisions are made and what the decision-making process might be, in case you are interested in leadership down the road in your career. So I'll pause there. And yeah.
Thank you, Dr. Kulkarni. I think that is a great point. And one of the things that a couple things actually that you mentioned there of really the benefits of getting interns involved in some of those administrative discussions and the behind the scenes, really understanding kind of the business side of things. And, all of our sites in the Great Lakes region and Valley Oaks, obviously being one that does a really great job of getting the interns involved in some of those discussions, letting them be involved in some of those committees and those meetings to really, get a sense of what it's like. And to your point, also the flexibility of just talking with our interns and really trying to tailor that internship to what your interests are. And so, all of our sites in our Great Lakes region are really, really great about sitting down with you, talking about what your interests are, and making sure that we can deliver a training, schedule to you in such a way that it really, you end the year feeling like you've got all those experiences that you wanted and are able to really kind of hone in on some specialty areas. But as Dr. Sklar mentioned, we might challenge you in some other areas too. And a lot of our sites, what I think you'll hear is just that flexibility, but also really tailoring it to the intern, specific intern. It's not a one size fits all necessarily. Our sites do a great job of taking that approach of really wanting to make sure that your training year is what you want it to be, and that you get a lot of those experiences that they have to offer. So thank you, Dr. Kulkarni, for your overview, and we will move on to adult and child health. So that will be Dr. Frederickson.
Thank you. Hi, everyone. I'm Hannah Frederickson. I'm the site training director here at Adult and Child Health, and I'm also joined today by two of our postdocs who are NPTC graduates, Kennedy Odulio Papa and Kendall Schrack Saunders. So you'll see them on here to help answer some questions later. So we're a community mental health center. We're largely in central Indiana. We have several locations, but I think most of our addresses are Indianapolis, with a Greenwood and a Franklin location as well. We have 2 internship positions for the next training year. They're largely generalist positions, but as Dr. Sklar had said, that we also kind of take the same approach where we try to tailor our interns' experiences to what they're hoping to get throughout the year. So that could be trying to kind of have more contact with children or do some addictions work. The other thing I really wanted to highlight is our crisis services that we offer. It's a pretty robust crisis support. And it's kind of unique in the fact that our crisis center is in the clinic where our interns are serving clients. So it's not unusual for them to kind of step in and offer support as needed for our clinicians. So it's really a gentle and kind of warm handoff there. It's a living room approach. So clients can just kind of walk right in the building and get services there as a way to try to reduce hospitalizations and things like that. And we have a prescriber on site. And interns also have an opportunity to serve in the crisis center if they'd like, so different shifts and things like that. Our postdocs that are on the call today have done some of those shifts, so they can answer some questions about that if anyone has anything. I'm trying to think. Our clients are across the lifespan. Most of the services, again, will be therapy, and then you'll have interns have a day devoted to site testing as well. So that's also a pretty big part of their training with us. And I think that's mostly us. So we'll stay around for questions and things like that. But yeah.
Thank you, Dr. Frederickson. I had the pleasure of seeing that kind of living room style, that approach to crisis services, and it really is a phenomenal way for the interns to get experience in working within those pretty intensive crisis services under supervision. And so again, just to echo, this year is a year that we do invest in trainees, and really we may challenge you in areas that you're less comfortable, but you will always have a lot of support from your supervisors, your training directors, along the way. And so it's a wonderful year, and feeling like that balance of we're going to challenge you, and also you're going to have a lot of really lovely supports and resources available to you to navigate those things that might be a little bit new or unfamiliar to you or a little scary at first. So thank you for that overview, and we will move on to Aspire. And I think we have a couple representatives. So that we have Dr. Dross Gonzalez and Dr. White here to talk about Aspire.
Yes, thanks, Dr. King. I am Dr. Sarah Gonzalez. Thanks everyone for coming today. I'm so excited that we're already looking into next year. I feel like our new interns just started and we're starting to roll and they're starting to get their feet wet. But it's so great to be looking ahead to next year. So thanks for your time, for coming to hear about us. We're always excited to share what we do. At Aspire, we talk about the 3 Ps: our patients, our partners, and our people. The thing I want to focus on today is to tell you a little bit about how we treat our people. I think that's something we're really proud of at Aspire. Being an intern here, we focus a ton on your well-being. We have an entire well-being program where each month we focus on a different element of well-being. And your participation not only is encouraged, but it's incentivized. You can actually earn gift cards for taking care of yourself. So you can earn money, like we pay you to take care of yourself. How cool is that, right? So, I think it's so important that we engage in self-care, and you'll see that from day one, during your interview, during your days here. It's incredibly important to us that you're caring for yourself. So we are a community mental health center as well as a federally qualified health center, hopefully going to be a CCBHC here shortly. So that, you know, might change a bit about how we provide care. But again, all of the things that you'll get exposed to, just like all of the other sites said, we do have a lot of similarities. We are a generalist training facility. You will have exposure to pretty much anything and everything. I always get asked, you know, what are good qualities of an intern, and flexibility always comes to the forefront, because every hour on the hour, if you're lucky enough to make it through a whole hour without a crisis, you're going to have to flex, right? So you're going to have to kind of change your approach and be able to meet an individual where they're at. We focus on whole health care. Just like I said, we focus on you as a person. That's how we focus on our clients here. You know, how they are looked at as far as like that holistic being. We look at all of the social impact, looking at employment, housing, like all of even socioeconomic status, all the things that can impact their ability to be present. As we know, like when we're looking at hierarchy of needs, if those basic needs aren't met, they're not going to adequately engage in therapy. So that holistic healthcare is what we do. We have primary care clinics embedded within our behavioral health care clinics. As an intern, you will also have the opportunity to participate in a weekly integrated care staffing, where you have exposure to our entire team: psychiatrists, medical doctors, social workers, licensed mental health counselors, marriage and family therapists, and psychologists lead those. So psychologists here really are looked at as leaders in the agency, and you as an intern about halfway through have the opportunity to lead that. So we are growing and developing you from day one. I always say this is a year-long job interview. We want you to stay. We want to continue to grow and develop you, and we want you to become one of our supervisors, which we've done a great job at so far. You know, we've been able to keep lots of folks and turn them into, you know, supervisors. So actually one of our interns just got promoted to director like last week, Ryan, who was an intern with us. So, I mean, it's been amazing to watch him grow from an intern to a postdoc and now a director. So again, you know, that's something that we highly value here is you as a human, as well as you as a trainee. You know, we want to grow you holistically, just like we do with our clients. As an intern here, you will have the opportunity to be placed at one of our outpatient clinics. Our outpatient clinics that we place interns at are in Indianapolis, Carmel, and Noblesville. And that's where you spend the majority of your time. So you're there about 4 days a week. On that 5th day, so about 8 hours of your time, you do 3 different rotations. One of those rotations is in our substance use programming. So we have an incredibly robust program, from relapse prevention all the way to more of that locked facility, you know, that 3.5 ASAM level of care. So you will be able to get exposure to all of those different levels. You also will be able to do a rotation as a behavioral health consultant in our integrated care clinic, and then also within residential care. So residential care can either be at our group homes or our substance use residential care facilities. Depending, again, you know, it's more like choose your own adventure. We can give you exposure to whatever you want, within reason, of course, but, you know, we try our best to make sure that we're meeting your needs, because your growth and development is always at the forefront of what we're doing here. Thanks.
Thank you for that overview, Dr. Gonzalez. I will echo, you know, what she had said at the beginning. Again, I can tell you from the feedback we get from interns that they feel that level of support from their supervisors, training directors at Aspire. And again, you know, that goes across all of our sites really in the region. But to your point, Dr. Gonzalez, the focus on the intern and making sure this is an intense year. It's a bit of a grueling year. It's going to be a lot of things that you're juggling, you know, within your academic program, learning a new setting, the training requirements, all the hours and the client care. It's a lot. And, you know, our sites really are invested in you and making sure to help take care of you along the way, and helping to remind you to take a moment and take care of yourself, as you're also focused on a lot of other things external. So, you know, I will just say that the things that Dr. Gonzalez was mentioning, I know a lot of our sites do really well. And again, looking at the feedback we get from Aspire every year, that is something that we see across the intern feedback, is they do feel very, very supported and well taken care of. So we appreciate your efforts in that. Thank you for that overview. And we're going to throw to HealthSource. So we have Dr. Carlock here with us today to talk about our newest site in the region, HealthSource of Ohio.
Thank you, Angela. Appreciate it. I'm glad to see everyone today. And yeah, we are sort of new to the consortium. I will say that I did my internship in the Cascades region. I mean, one of our fellows has actually did his internship in the central region too. So we do have some representation from NPTC in our organization so far. HealthSource is a nonprofit federally qualified health center, or FQHC. We offer family medicine, pediatrics, OBGYN, dental services, vision, pharmacy services, and as behavioral health providers, we are integrated within all of those areas. Generally, people who are interns who come to us will work in the primary care behavioral health model and serve as behavioral health consultants. And that means we'll work in the same offices as primary care providers and nurses, and you'll be talking to them very often. We work with their OB/GYN providers too. And we work in the medical clinics, which you can kind of see over my shoulder. I'm there today. So we are very integrated into the medical system here. And our big role is to support primary care, really focused on supporting the behavioral health side of primary care. And so behavioral health consultants, we see patients through scheduled visits. So they may get a referral, and then we can see the patient next week. And a lot of times we see patients via warm handoff, meaning, somebody comes in, they may be wanting some antidepressants, or somebody in their family died, and then either the doctor or the patient can ask to speak with us, and we can kind of come in the room right away and see that patient. And it's really a special thing to be able to do, because a lot of times you'll be sort of injected into somebody's life when they had no clue that they were going to be seeing a behavioral health provider that day. It's a really unique experience. And we also see other areas too. So obviously chronic pain, medical issues, diabetes, hypertension, and typical mental health issues. So we cover kind of a broad range of areas, and we see patients across the lifespan. It's very common to see like a 5-year-old, and then a 70-year-old, and then a 30-year-old, and across one day. So we're a generalist program, but you're going to see sort of everything on a daily basis. And it changes across the day. You may be scheduled for 7 patients and end up seeing 10 one day because you get several warm handoffs. It's just, others have mentioned being flexible, and that's really kind of what the PCBH model is really emphasizes that, because we kind of have to be on our toes, but I think it's a lot of fun, and you get to work with the medical team too. So there was really that team atmosphere in the clinics and across the BH team. I think I already mentioned about warm handoffs. And like I said, we do schedule visits too. So typically we see patients for brief periods of care. So maybe 1, 2, 3, 4, 5, 6 times. Some patients will need to keep seeing us, more than that, but kind of treat it on a person by person basis. And we really focus on the sort of contextualism in primary care, and just kind of what the patient needs and what's going to help improve their overall health for the medical team. Our program is a mission-driven program, so we serve rural and underserved Appalachian communities. And interns are going to split time between our Georgetown and Hillsborough clinics. So this is a largely rural population. And like it says, these are Appalachian communities, and sort of they're about 45 to 60 minutes from metropolitan Cincinnati. That's where they're located. So we have a lot of rural farmers and things like that. We have some patients who show up to our clinic in a horse and buggy, that kind of thing. We have LGBTQ identifying individuals too. A lot of people don't think you see that in rural areas, but we have those individuals as well. So we do get a broad range of people that you see. And it is a cultural experience in itself, getting to work with the Appalachian community. It's some people are surprised that the culture is different even within this part of the country. And we're really proud ourselves on serving the rural population. And we're recruiting 2 positions this year. And we've, although we're new to the consortium, we've been training practicum students and postdocs for 6 to 7 years now. So we're trying to have the whole continuum of practicum students, interns, and postdocs going forward. And we're excited to talk with anybody who wants to speak with us, and excited to be in the consortium now too. And just let us know if you have any questions. Thank you.
Thank you, Dr. Carlock. We are very excited to have HealthSource as one of our sites. And to Dr. Carlock's point, HealthSource is unique in the type of setting that it is and offering really that true primary care behavioral health. I know a number of our other sites, many of them also offer IHC type experiences, rotations. And so we can definitely talk about what that looks like within any and all of the sites in Great Lakes region. And HealthSource is a very unique site in being primary care focused and providing that PCBH model of training. So we are thrilled to have you and very excited to be able to have interns rotating it, in a specialized type clinic and setting. And we'll open it up for questions kind of at the end on what maybe some of our other sites are doing in that area of integration as well. So one last site before we open it up for general kind of a Q&A and discussion. We have, last but surely not least, we have Bowen Health. So Dr. Griffin is here to talk about Bowen.
Hi, everyone. So my name is Dr. Aurora Griffin, and I was an MPTC intern many, many years ago, and I stayed on at Bowen, and now I'm the site training director. Bowen is, I'm going to repeat a lot of what other sites have said too, but we are a community mental health center and federally qualified health center. We are primarily across the northern part of Indiana. We're slowly trickling down a little bit. We just opened a site in Kokomo. But majority of our sites are going to be primarily outpatient mental health treatment, psychiatric medication management, primary care, and a couple of our sites just open dental services. So that's exciting. We're kind of just always growing. We have a really strong focus on total health care. We want to make sure that in these small communities that we can provide all the services and care that our patients are in need of. Like all the other sites, we're a generalist training site as well. And so our interns are going to see individuals across the lifespan and across the DSM. As far as diagnoses, I would say probably majority of our patient population has experienced some trauma. So trauma treatment comes up a lot here. Trauma-informed care is very like what we do. And so interns will primarily do outpatient mental health treatment and then psychological testing. And our interns do testing in majority with our community partners. So for Department of Child Services, probation, juvenile probation, a lot of times they're doing testing related to that. They also do testing in collaboration with our medical and psychiatric providers doing consultations and things like that. In addition to outpatient, we have an inpatient hospital for adults. We have a methadone clinic and we have transitional living facilities. So interns have the opportunity to tour all those places. And then if they would like to provide services in those locations, we incorporate that as part of their internship program. Yes, we are going to take 3 people next year. Those are the things that are coming to mind. But I'm also open to more questions during our Q&A.
Thank you, Dr. Griffin. I appreciate that. Yes, it is obviously a lot of what we talked about today. You all heard some things that were consistent across multiple sites, and I hope that you all heard obviously some of the unique things that each of our sites do and how they support our interns. And so I'm going to pause before we do have some previously submitted questions, of course, that we can run through, and I will help to maybe throw to a few people or ask a general question and ask the training directors or anyone from the site representatives who want to talk about some of the things. But before we jump into those pre-submitted questions, I want to pause and just see if anyone who has joined us live right now has any questions that you would like to ask. Either in general for NPTC for any and all of our sites, or if you have a question for a specific site or a specific training director, feel free to address them specifically. Okay. I won't sit on that one too long, so we make sure we don't have a lot of just silence, and we can get through some of the pre-submitted questions, and maybe that will spark some thoughts and other questions. You are welcome to ask any questions along the way. So we do have some questions that I will kind of throw to a few people or open for general, but if anyone on the call, again, if you have a question at any point, please do not hesitate to unmute or submit it in the chat. And we can either answer it in the chat or we can talk about it here. So we will take your questions, comments, or anything that you would like to know more of. We'll take them in any format you feel comfortable sharing. So I may throw just a couple questions out for everyone. The first thing that stuck, and I guess in a really good way that I was excited about, was hearing so many of you introduce yourselves and then talk about either yourselves or your teams and the history of involvement with the consortium or being former interns. And so one of the questions that we get and have gotten before is, for those that are alumni, why did you stay? Why did you stay either within NPTC or within the site that you're at now? What led you to stay, and what made you to seek maybe the leadership role that you're in now? And I'm going to open that up to anyone who wants to unmute and answer that question.
I stayed for a couple of reasons. So I think the majority was the support that I received. So we do have a lot of locations, they're all spread out, but I feel like the psychology team and just local leadership teams, there was a lot of support provided. The amount of training, so through internship year, the didactic trainings are great and you get so much. And then within Bowen, they just also have a whole library of trainings and access to trainings. And then the variety of work. And I think the reason, because community mental health every day is different. I think you heard a couple of us say that you have to kind of be on your toes and go with the flow. And I didn't want to get bored, and I'm not bored. And also having new challenges. So I think those are all great. And then leadership role, I love being a supervisor. Like right now, that's one of my favorite parts of my job, is that giving back and training and challenging and watching people grow. And then I think there's that we get to learn from them too. And so it keeps me growing and learning and curious, which I appreciate.
I'm going to wait and see who else unmutes and wants to maybe chime in on that response also. But while I'm waiting and looking here, I will add to that, Dr. Griffin, that that is seen and felt on the side of the interns, but also those of us who work with you and alongside the sites, that those sites and all of our sites, really, I can speak confidently in the Great Lakes region, the supervisors love what they do. They want to train, they want to supervise. They're invested in it, and it shows, and it comes back tenfold in the feedback that we get from interns, again, that they really feel that sense of passion. This is not just a person who's in a role that's their job. They have to do that. They want to, they love it, and they are invested in you and your training, and you will feel that and get to experience what Dr. Griffin just described of, like, I love supervision. And when you have a supervisor that loves what they're doing, you as an intern get to, be on the receiving end of that. And it tends to align really well in that it produces a really nice training experience. And by the end of the year, hopefully you feel that you got everything out of supervision, but also everything out of those clinical activities and the services that you were hoping to get out of your training year. Anyone else want to answer or talk through some of that? I know we have a lot of alumni on the call. That's super exciting, but I won't put anyone else on the spot unless anyone else has anything else to add on that.
I can answer, Dr. King. I am a postdoc at Adult and Child, so I'm a very fresh alumni. And part of me that wanted to stay was, to Dr. Griffin's point, the support that I received at Adult and Child. I feel like Dr. Fredrickson and the rest of our supervisors have been incredibly supportive, and I see a future at Adult and Child. I feel like there's mobility, I feel like there's flexibility, and so I didn't feel quite done at the end of the internship.
Love that. Thank you. And someone that's going to I'm actually going to use that, Kennedy, to tie in my next question and, open it up again, Q&A. But I think it was Dr. Gonzalez who maybe mentioned earlier, we get a question every year of what do you look for in a candidate? What do you look for in an applicant? As a training director, as a supervisor, what are you looking for as an intern? And I think it was you, Dr. Gonzalez, who mentioned the flexibility. And to your point, Kennedy, that like having that relationship, the site being flexible, the intern coming in with openness and flexibility, often produces, again, the most successful training year on both sides. But I'm curious from the rest, anyone, any training directors or representatives, what are some of the things, the key traits or things that you do look for when you're looking through applications and materials? What makes a good fit for an intern with your site? Don't everyone talk at once.
Okay, I'll jump in again.
Okay, Dr. Sklar, I knew you would be up for the challenge. Thank you.
You're welcome. I think it's always a challenge when we go through all of these absolutely phenomenal applications that we get, and we get a lot of applications, and then having to figure out how many of those we're going to interview, and then how we're going to rank the ones from top to bottom. It's always fun and challenging. I think some of the things that we look for is that openness to learn, that willingness to receive supervision and feedback, the willingness to do things maybe that you haven't done before, and to sort of recognize both your strengths and your weaknesses. Another thing is that's really important, I think, for us, because as soon as you're selected, we start that treadmill and it starts picking up speed. So it's kind of going by the time you actually show up. But is having some prior experiences, having some good practicum experiences, hopefully in rural community health, because it's different than let's say a college counseling center. Although we've had some people who have had that experience and they did well. So being open, being bright, being willing to learn stuff, and coming in with a little humbleness, recognizing that you don't know everything yet. So that's it from our side.
I could not agree with that more, of just that openness to learning, and again, being willing to learn new things, being willing to try new things, and push yourself out of some comfort zones, and that goes a long way. Dr. Fredrickson, I noticed you unmute. Do you have more to add to that?
Yeah, I was kind of adding to that, because I definitely agree with that characteristic as well. But I think someone who enjoys collaboration and kind of a team-oriented approach, I think it's easy for clinicians to get swallowed up by community mental health. So someone who enjoys kind of connecting with whether it's their fellow interns or just kind of staying engaged with other clinicians, I think it's so important. And then just kind of someone who's mission driven or just passionate about what we're doing. It tends to help out quite a bit.
Yes, absolutely. One of the things I'll say to that point, Dr. Fredrickson, of being mission focused, and Dr. Sklar, to your point about working in rural and underserved areas, I can't tell you the number of times that we hear interns say, I thought I knew what rural was until I was here at this site, or until I got exposed to this, in a good way. I mean, in a challenging and good way. But it is, we coming out of school and academics and the classroom settings, and then being working and living in these communities and providing services to very rural and very underserved individuals and populations, can be a bit of an eye-opener. And most of our interns will say it was, such a phenomenal learning experience. And again, what I said earlier, you get to do that while having a ton of supports and a ton of resources and supervisors to help you along the way. So it's a great time to kind of get those experiences that you might not otherwise have, and be working in these settings and communities that you might not have had exposure to before. Anything else on that? Yes, please, Dr. Carlick.
Hey, I just wanted to say, for looking at our program, I know there's typically a lot of questions about like whether you need to have worked in primary care before, and that would be a a good thing in general. I will say that I had no primary care experience before I got my internship at Health Point in the Cascades region. So there's also the other side of it, any kind of medical experience or just a strong interest in, primary care or integrated care, and kind of knowing why you're into us and why you're into it. Versus just that it sort of seems cool. And flexibility obviously is kind of a big one too. I think everybody's already mentioned that. And just knowing that if you have the willingness to try to work in our setting, you can do it. And people shouldn't be scared to apply for a setting like HealthSource, because we ramp people up in a slow fashion, and we have them shadow our primary care providers, medical assistants, our clinical pharmacist, and our front office staff, so they kind of know what the whole operation looks like before they really have a full patient caseload. So even if you haven't had experience in primary care, you can still apply. Just putting that out there. Thank you.
Thank you for that. And you brought up a really good point, Dr. Carlock, that I might want to mention, and this goes obviously to all of our sites and everyone. During the application process, one of the real benefits of applying to NPTC and the region is you get to, within that one application, you're essentially applying to the Great Lakes region. And you could apply to one of those sites, or you could apply to all 6 of those sites with the same application fee. So you don't have to pay for each of those. So again, it gives you a chance to really maybe go ahead and apply, even if you're on the fence about a site, because then during the interview, you get a chance to really ask a lot of those questions and make sure that it's a good fit during the application process. But Dr. Carlock brought up a good point too on your APPE. One of the questions I often hear is, I'm interested in applying. Let's take that as an example. I'm interested in applying to HealthSource, but I don't have any primary care experience before. So how do I do that, or what do I say? And we just encourage interns to be transparent in your application materials, your cover letters. You have to have all of the experiences leading up to this. We are a training facility. All our sites are invested in training. So while we do hope you have some good academic foundations and solid knowledge and foundation there, we are invested in training you. And so if you just communicate to us in the application materials, I have limited experience in this area for XYZ reasons, but I'm really interested, very eager, would love to learn more. That's going to go a long way for our sites, as long as they know that why you're applying. So again, kind of tell us why you want and are interested in these sites. And you just have to do that on your cover letter. And you could list all of the sites and the reason why you want to apply to each of them in one cover letter. And again, all of our sites are very used to seeing that and getting applications and knowing that interns are applying to multiple sites. So we don't take offense to that. We're part of a consortium. We're all very good partners. And we do encourage you to go ahead and apply, even if you're unsure. But if it's something you're interested in and you would really love that training experience, again, that goes a long way. Just communicate to that to us during your application process.
I have something.
And I want to make sure. Sorry. Yes, Dr. Cohen.
Can I add one piece? Because a lot of the folks talked about, openness to learning, willingness to try something new, going beyond your comfort zone. And then Dr. Carlock kind of highlighting it's okay if you haven't had the experience, know why you're interested and kind of be familiar with the model. I think openness, it is a challenging year, right? There is going to be some anxiety inherent in the process. And I think when I think of our interns who've been successful over the year, because there's so many adjustments, you're moving across the country, leaving your support system, it's the culmination of your doctoral program, the ones who are open in supervision about some of those challenges, so the supervisors know where you need the support, that goes such a long way. And it's been our interns who've been able to kind of let down their guard and trust that our supervisors are here to catch them, that have probably had the most meaningful experiences. And so I'll just kind of, leave it there.
Absolutely. Love that. Yep. Very much the openness to that and being willing to kind of learn and explore. Yes, for sure.
Can I add one more thing, Dr. King?
Sure.
So the interview process is pretty scary. You do your application, you hope you get selected. Oh boy, I'm selected. I picked a time, and now you have the interview with one or more people that are judging everything that you do. So no anxiety. but I think it's sorry. I do have a very bad sense of humor. So I think it's really important just to be yourself. I mean, that's what we want to see. We want to see the strengths. We want to see your humanism. We want to see who you are as a person during that 45 minutes or an hour. And, we're trying to figure out how you fit for us, and you're going to be doing the same thing in terms of, are we a fit for you? So that is certainly an important part of the whole process.
Absolutely. Could not agree with that more. It's a mutual interview. We hope that our interns are interviewing us as much as our sites are participating in that interview. Yes, Dr. Kulkarni literally just put that in the chat as well, and 100%, because we want it to be a good fit. Because when it's a good fit, that means it's a very good training experience on both ends. And we of course want that, and we want that for you, and we want that for our sites as well. We have about 8-ish minutes left, and I have one question that was submitted for one site specific, so I am going to ask this question, but also I will ask, we can open it up to other sites. So the question is for Aspire. So Dr. Gonzalez, if you want to answer this initially, and then again for any of the other sites who want to jump in and talk about this. So the question is about your rotations. So it mentions that you have 2 6-month rotations, and if you could tell us more about either where geographically those rotations are, or the types of training experiences and how they differ. And then obviously the question for anyone who wants to also talk about your site would be just what do those training rotations look like? How do you structure your training rotations?
Yeah, definitely. Thanks, Dr. King, and thanks whoever submitted the question if you're on here, or if not, hopefully you'll watch the video. But this has changed a bit. So we used to have 2 6-month rotations, but we actually moving into next year are going to do 3 4-month rotations. So I would imagine they were looking at the information from our site previously. So basically the way that our rotations work, they're placed at an outpatient site for about 80% of their time, right? So then for 1 day a week, like 8 to 10 hours is when they do their rotation. So those 3 rotations are the substance use rotation. On that rotation, they'll be spending about 8 to 10 hours doing different groups all through that whole line of care, from relapse prevention to extended outpatient, intensive outpatient, both residential as well as, in our outpatient setting. That they'll be supervised by our director of addiction services, and then Dr. Ryan, who was one of our interns here prior, who is now in that role, will be supervising them to provide that higher level of SUDS care. So that's what that looks like. The other rotation is as a behavioral health consultant. So that's in our integrated care clinic. They will be working hand in hand with a primary care provider, shadowing them in all their sessions and doing warm handoffs for things like tobacco cessation, weight management, mild depression, mild anxiety. They'll also be able to provide some assessments on that. So they can do, some short-term assessments, diagnostic assessments. Most of those are screener-based assessments, not necessarily full-on psychological batteries. But that's how that day will work. And those clinics will be in Carmel, Anderson, and Noblesville. So location-wise, that's kind of where they'll be. Our addiction services are across all central Indiana. We have them at all of our outpatient locations. So there are our residential facilities are in Anderson, and then again, Carmel, Indianapolis, Noblesville, Lebanon. So those are the locations. Our third rotation that we added for this coming year of interns is that residential rotation. So the residential rotation will be spent in our group homes, providing more like skills-based services and therapy-based services for adults. So it's all 18 or older in our group home facilities, as well as our substance use residential care. So they could be providing, again, more of that SUDS-based services in a residential setting. So again, we did shift that from that 2 6-month to 3 4 months. So we can give them more exposure to some of the other treatment that we offer here.
Thank you, Dr. Gonzalez. And I may ask anyone else who wants to talk about, how your rotations are structured, but also maybe another part to that question would be, we talked a lot about how each of our sites can kind of gear the training tailor it to the interns and really take the input from the interns after you've matched about what they want to get out of that training year and make that more individualized. So maybe the question for anyone who wants to unmute and talk about that is, how do you incorporate obviously intern preferences and experiences that they want to get, and also what does that look like with your kind of standard rotations or training rotations or experiences that they may have?
I can share a little bit. At Valley Oaks, we ask interns on the front end to, what are all the things that you're hoping to get out of this year? I think everybody does that as a part of the individual learning and training plan. And I'll be transparent, there's a lot already embedded into the core intern experience. We want to make sure that you are ready to practice independently, right, when you graduate. And so the way that we typically structure working in some of those the different intern interests that might be beyond what's in the core of the internship experience is make sure we know about that ahead of time and are having conversations with interns about where those experiences exist in our system. But we typically don't add them in until later in the year, because it's a really steep learning curve to adjust to our system and all of the different expectations and kind of getting up and going with your direct clinical work. And so it's typically more towards the mid-year mark that we say, okay, now what are we missing? Because sometimes what we find too is that in the core experiences, interns are getting some of the stuff they weren't expecting to get even in that. And so sometimes at the mid-year mark, their wish list has sort of evolved. And so that's just kind of high level how we handle it at Valley Oaks.
Great point. Yes, that there's a lot to try to absorb initially, and so letting them kind of get that foundation and then assess and see what more do you want and where do you want to focus, or where do we take the rest of the training year. Well, out of respect, we only have just a couple minutes left, and I want to draw everyone's attention to, in the chat, some of our team members have dropped a few links that might be helpful for you. So we have some links in there on application materials and some FAQ and even interview guidelines, tips, and things like that. So please, look at those, but also a lot of our training directors are dropping their contact info in there. You can email any of our training directors directly. You can email NPTC if you have a site specific question. We will send that to the site, get the answer, connect you with the site. Or if you have a general question about any and all of our sites, again, send that to us and we would be happy to answer additional questions. So with 2 minutes left, I will pause and open it up. Any last comments or questions or feedback? All right. Hearing none, we wish you all the best of luck in this process. We know it is not going to be without some anxiety and stress, and we are grateful again for you considering NPTC and specifically our Great Lakes region. I'm confident that you will find a really good site that fits with what you're looking for and have a phenomenal training experience and supports if you were to land and match with one of our Great Lakes sites. So we do hope that you will continue to consider us, and we do hope to see your name on some of our application material here coming up very soon. Don't hesitate to reach out if you have any other questions. We appreciate your time today and best of luck to you all. All right, thank you everyone. Have a great rest of your day. Bye-bye.